think that's great. Welcome back to the show. It's Makeover Madness, and please welcome Dr. Stephen Mulholland. He's with us today. You know, everybody wants to know about cosmetic surgery, so we've got the real source here. And we're going to talk about what's happening in 2005 as far as there's some new techniques, new procedures.
Yeah, there's some tremendously exciting treatments all on the non-surgical side.
Now, see, this is non-surgical because a lot of people don't want to have surgery necessarily the first go-around anyway.
Surgery's always there waiting for you.
Yeah.
We're always there with a scalpel if you need it.
Yeah.
But on the non-surgical side, 2005 is, to me, really the year of the body.
Okay.
The year of the body.
I love that.
And that's not the Chinese calendar, that's the cosmetic surgery calendar.
Okay, very good.
We have so many things we can do for the face, and we've focused so much on the face that the body has kind of been relegated to, well, Dr. Mulholland, what do I do for my loose, wiggly, jiggly parts? And I would always say, well, that's why we have candlelight and dimmers, because we don't have a lot non-surgically. But there's a new treatment called Lipolite that attacks fat non-surgically, a non-surgical liposuction technique that is approved here in Canada and a number of countries throughout the world, not yet in the United States, but it's proven to be really a breakthrough in how we deal with those lumpy, bumpy areas that detract from the figure and form you want.
Yeah, you could work out as much as you can, and you look back here and you go, well, you know, you got some baggage happening.
Well, that's
so
exactly
Lipolite is the name, is what we would
Lipolite is a program, it's like liposuction lightly. Liposuction meets cellulite.
Okay.
And the real frustration is, as you say, you exercise your diet or you use caloric restriction. You don't eat so much. But if your hips and your outer thighs give you that hourglass, lumpy, bumpy figure, you're going to shrink symmetrically and you'll still have that lumpy, bumpy figure. And the only way we had to deal with it was liposuction, which of course is invasive. It's surgery, there's pain, there's recovery. You can get some great results, but many, many people don't want to go there. And we just didn't have anything to offer. This new program uses, and I think we're doing a show on it on the new year.
We are going to have a whole story on it coming in the new year, but kind of give us what the rundown is. I know it's a dedication of time.
It is. You have to basically show up for 8 weeks, and in 8 weeks we can make about a 2 to 4 inch reduction in your thigh, about a 4 to 5 inch shrinkage in your tummy and your hips, and that's astounding in 16 visits in 8 weeks. And the beautiful thing is you don't have to diet, exercise, or drink water. Just show up and we can melt it.
What happens? Does the steam come off the machine as the cellulite is, what happens? Where does it go?
What we're doing is we're taking the fat cell, which is called a lipocyte, and we're tricking it into breaking down its constituents, which are free fatty acids and glycerol, the nasty things, the things that are on all our French fries, and we just accumulate them in the areas we don't. So we use radio frequency energy and laser-like energy, and we go over the areas, and we bypass the skin, and we heat up the fat cell. The fat cell goes, yikes, you know, I better give up my contents, and it shrinks from a grape down to a raisin over about 8 weeks.
And does it get absorbed in the body in other ways?
It's very, very safe. I did a long-term study on patients measuring cholesterol and VLDL and HDL and all the nasty things.
All those big terms that we don't really care about, but we need to know.
Yes.
We just want you to get rid of the fat,
The bottom line is, over that 8 weeks, we safely and metabolically shrink the fat down in those areas where you don't like it. So you just pick the zones you don't like, and you come in for about 40 minutes twice a week for 8 weeks.
Okay. Does it hurt?
Well, it doesn't actually. If you compare to all the other nasty things we do to look great, like Botox or fillers or hair removal or photofacials, this is the least painful of all.
Okay.
But ultimately, when people ask me that question, I tell them it hurts far less than the pain of living with the unwanted fat.
Yeah.
So usually the benefit exceeds the discomfort.
That's a good answer. That's a good answer. Okay, so it's 16 applications. So you go visit the SpaMedica, for example, twice a week for an hour, kind of a thing.
Count on an hour, in and out time about an hour.
And the results I'm going to see probably third, fourth weekend.
By the 4th week, you start to see tightening. So it tightens skin, it smoothens cellulite, and it reduces fat.
And after you go to this, do you have to like put some kind of cream on after you've been there? None of those
nothing
things?
you need. You basically get the fat areas treated.
Right.
You put on your clothes, back to activities.
Okay, and then how often do you have to go and, have it done? Because you're doing like an intensive program.
It is, and if you've shrunk the fat and you're not going to feed the fat cell, so if you're pretty consistent in your weight, that's going to be a long-term result. Those little grapes became raisins, and they're not going to come back. But if you feed those raisins, they swell up again. Yeah. And then if you have a recurrence of the lumpy area, then we're standing there waiting for you. However, very important to know that if you have cellulite, that's a chronic disease, that lumpy, bumpy cottage cheese skin. We don't even know what causes it.
I know.
We don't
that's
really.
Wild.
No. But this does smoothen it.
Okay.
But like high blood pressure or diabetes, you're going to need a maintenance treatment about once every 6 weeks.
Yeah. Okay, let's talk about liposuction, because when you have liposuction, that is a surgical thing. So you have to go get a chest x-ray and all those things, and blood tests well before, within the 3 months that you're having the operation.
Yes, absolutely.
And then, you know, some of the myths about liposuction, because, you know, that, boy, if you suck it out in one area, it might show up in another area, like on your ankle or something like that. There are a lot of myths. I think people, you know, pass on stories that they've heard. Tell us the biggest myth you've heard about liposuction, and tell us how long it does really last, and what are the benefits of it, besides making you feel better.
Well, you're absolutely right. There's a lot of urban myths of cosmetic surgery.
Yes.
And the top two involve liposuction. The first urban myth is that if you get liposuction and you shrink your tummy, your hips, your thighs, that the moment you put on weight, it goes all the way back to those areas right away.
Right.
And that's obviously incorrect, because we've removed some fat cells, but not all of them. So remember, there are fat cells that will still respond to your dumping calories into them. So you will put on some weight in those fatty areas, but far more common, the fat is distributed to other areas that you wouldn't normally put weight on. It doesn't just, if you put on weight, it doesn't just go back to other areas and leave those lipo areas alone. Right. So it's really a combination. The first myth, it goes to other areas. The second myth, it goes right back to your lipo areas. In reality, it goes a little bit here and a little bit elsewhere.
Okay, okay. So now we're going to talk about another non-surgical thing, a thread lift. That's interesting. Huge. Tell us about that.
I worked on in the last 3 years. In my desire to, I do a lot of facelifts, but there's a huge number of people that would love a facelift result without all the cuts and downtime and things like that. And
because the downtime is what, Stephen? What is it?
To be honest, you're not feeling right in your face for about 6 months. Yeah. You look great.
You're okay after 3 weeks.
But you look good in makeup, but you touch your skin, you say, oh, where's my face? It feels dead. And it takes time for the nerves to come back and the feeling to come back. And the results can be amazing in the right hands. So a facelift is here to stay, no question about it. Okay. But there's a huge market and an interest for patients who don't want the cuts or the scars. And so we use a local anesthetic, some long needles, kind of looks gross. We did a show on the thread lift here. And I go through the scalp and I insert these sutures, these threads, that then lift the face and give you a good 3 to 5 year result. And it's got the 3 R's that everyone loves: removable, replaceable, redoable. It takes about an hour to lift the face. So if you can take your cheek and pull it out.
Everybody take your cheek.
Take your cheek. Now pull it out.
Pull it out, everybody. Pull your cheek out.
If I can see your earlobes, then you're a good thread lift candidate. If you can go, it comes out past your ears, you need to cut it up and throw it away. Then you're a facelift person. So that's the litmus test for the thread lift.
That's good, because you may want to wait till a certain age to get the big facelift done. So maybe in the meantime you're noticing some things that are not quite sitting with you very well.
This is a great way to lift and reposition and look a certain age for many, many years, because it'll last maybe 3-4 years, but it's a simple thing under local to do a little thread here if your jowls come down, or a little thread here if this has come down. So I've done this for about 3 years, several hundred of them. I've trained a number of U.S. physicians, but it didn't really go crazy until it was done on Oprah about a month ago.
Yes.
And then
you trained the woman.
Yes, that did it on
who,
Oprah.
you know, that Oprah has that cosmetic surgeon. Dr. Steve Mulholland trained that woman to do that, so he should be getting the credit. But we have him. We have him. Now, quickly, I want to talk about photofacials, and you know, we mentioned them on the air. Let's kind of redefine what they are. And I like the application of one of the things that you told us a long time ago is where a woman really shows her age besides her eyes is on her hands. We get those age spots, and you can do photofacial on the hands too. But what is it? And
photofacial is now the most commonly performed light-based treatment on the face in the United States. Any given day, there's about 20,000 photofacials done. And all it does is take light, bright light, and radio frequency energy, and we treat your entire face. And over the 6 or 7 years I've evolved this program, it originally started for rosacea, which is redness and flushing.
So what, it would just kind of dissipate the redness?
It dissipates that pink and the redness. Then it really works well on brown spots and sun damage. And we've perfected to the point where we can even out fine lines and deeper lines and texture. And so even if you're not interested in lifting and thread lifts and Botox and fillers, the most beautiful thing about a woman is always her skin. Even if the jowls are hanging on their collarbone, beautiful, smooth skin is an attractive thing. And so making that skin even and bright and smooth and less porous is important. But women always work on their face and they forget the chest.
Exactly.
And that's important. If you go to an evening event and you've got your décolletage, you know, your face might look youthful and your chest looks like Tales of the Crypt. And that's our job.
It's true. You know, with all,
So keep the hands matching the chest, matching the neck and the face.
Yeah.
Keep it all in about the same
So
decade.
you kind of, what you do is you kind of zap, you zap, you zap, zap. A little pain in there.
You wear a topical anesthetic cream.
Yeah, that freezes your face. Yeah.
Again, it's uncomfortable. Nothing we do is comfortable. There's always a little pain for a lot of gain.
Yep.
And we treat the entire face. Takes about 30, 40 minutes. Makeup on, back to work. You need 5 treatments over 15 weeks, and you will generally improve 70% of your red, 70% of your brown, 30 to 50% improvement in wrinkles and texture.
And you'll notice a difference when?
After about the 2nd or 3rd treatment.
Yeah.
So it's about a 15-week program. By about the 5th, 6th week, people are saying, wow, your skin looks great. What are you doing?
Or they don't even say that. They say, gosh, you look good.
Something like
great.
that,
Yeah, something like your skin, you know, not even mention your skin. Did you get your hair cut? Something happened with your hair?
I always ask clients, you know, what are people saying? Because it's those spontaneous testimonials from people that don't know what you're doing that really give you the benchmark that, hey, I'm really improving my skin.
Yeah, and I also want to say photofacials are good for marks
Good
there.
for those brown spots.
Okay, one more thing. I know so much to ask you. Fillers. Let's talk about fillers. There's different names. There's different names for fillers. Some of them are permanent, some of them are not. Let's talk about those.
Okay, there's the fillers that are non-animal. Everyone's gone non-animal. Collagen almost isn't injected anymore.
Is that right? Wow.
Really not much anymore. It's the hyaluronic acids which are sexy. Those are the Restylans, Perlanes, Juvederms, Hyloforms. There's a whole bunch of names. But they're complex sugars. You inject them in the skin, they absorb your own water, and they plump you out. Okay. So you get those Angelina Jolie lips and fill in these smile lines. And generally, as we age, we deflate like a balloon. All the air comes out of us.
Mr. Good News.
And part of good lifting is filling. You should never really lift without filling. Fill centrally, lift laterally or to the outsides.
Right.
And so the fillers are a great way, a quick fix-me-up that look like a facelift but aren't. There's new longer-term ones like Derma Live, Derma Deep, the newer versions of Articol.
How long do they last?
And they'll last a good 2 or 3 years, even longer. And then there's your fat. A lot of people saving fat for a rainy day. Now you have a place to put it. You know, put it in your face.
So when you have an operation of some kind, then you can save the fat and you can inject it.
Absolutely. So don't do the lipo till after your face procedure because we want to have a little bank that we can use.
Wow, there's so much to do, isn't there? So much home. We always talk about home day. We should just have, you know, just kind of Dr. Mulholland Day every Thursday for, you know, our own renovation. Don't you think?
One room at a time.
One room at a time, one room at a time. Okay, we say goodbye to you. Thank you so much. Thank you so much. Dr. Stephen Mulholland from SpaMedica. We'll take a break. We'll be back right after this. That was great.